Ultrasound imaging has been around since the 1950s. It developed rapidly, and it's now the most commonly used medical imaging technique. This is in part because it's safe, fast, and relatively low cost. Kia ora, I'm Laura. I'm a research associate in the Department of Physics at the University of Auckland.
Kia ora, I'm Jamie, and I'm a research fellow in the Department of Physics at the University of Auckland.
We can make images of biological structures of all different sizes, from whole organs like the liver to tiny blood vessels in the brain. We make an image by bouncing sound waves off of the structure that we want to look at, and then seeing how long it takes these echoes to come back to us. However, the human body is a very complex system of organs, blood, fluid, and bones. So instead of traveling in straight paths, the echoes can take complicated paths that we don't expect, which makes it harder to image. This problem is a lot like trying to take a photo through fog. You can see objects which are close to you, but further away, the fog scatters the light coming to your eyes, and the image is blurry and noisy. So as physicists, we approach this problem by trying to understand how sound interacts with complex structures. This can help us make better images with the data that we get from ultrasound imaging machines. This in turn helps doctors to monitor the health of organs and tissues, and it can also help with the early detection of diseases like cancer.
In addition to the structural information that ultrasound provides, many diseases can be detected by looking at the chemical information. In the early 2000s, a new and exciting type of imaging was introduced called photoacoustic imaging. This technique is sensitive to specific chemical information. To make these images, we add a laser, photo, to an ultrasound machine, acoustic. Different colors of light interact with different molecules. When the light gets absorbed, it heats up the molecules and it causes them to expand and create a sound wave, which we can detect with a normal ultrasound probe. This means that photoacoustic imaging can determine things like how much oxygen is in our blood or how much fat is in our arteries. However, just like with ultrasound, the sound waves generated in photoacoustic imaging travel differently through our bones than they do through the rest of our body. In our research, we are working on determining where these waves come from so that we can use photoacoustic imaging to look at the chemical composition of the blood inside of our bones. Our goal is to help doctors detect bone diseases earlier and with more accuracy.